Hi, good afternoon for you. So I'm Ridz, I'll be your trainer for today. Okay, so before we begin the balance assessment, we'll be doing a little bit of pre-test consideration. Alright, so let's begin with the pre-test consideration. Okay, so firstly Firdaus, have you had any exercise today?
No.
Okay, good. Means you have an ample time of rest, huh?
Yeah.
Okay, good. So did you consume any caffeine within 3 hours of the testing?
No.
Okay, good. Did you eat within 3 hours?
No.
Any food? No?
No.
Okay. And have you consumed any alcohol within 3 hours of the testing?
No.
And did you smoke or consume any tobacco within 3 hours of the testing?
No.
Okay, good. And ensure that you hydrate yourself during the 24 hours. Huh?
Yeah.
So secondly, I would like to check, do you have any medical history or injuries that may interfere with the assessment?
No.
Alright. So are you currently feeling well?
Yeah, I'm feeling well.
Okay, good. So at any point of time, if you're not feeling well, whether before, during, or after assessment, please inform me straight away, okay?
Yeah, sure.
Okay, so now we'll be checking your blood pressure and your heart rate. So is that okay for you?
Yeah, sure.
Okay. Okay, so now I want you to put your right arm forward. Okay, those seems that all is good. Alright, I just need to brief you on the general indications for terminating of test. So at any point of time, if is there any risk during your prolonged standing, I will terminate the test. And you have the right to stop the test also if you are not feeling well, such as like physical or verbal signs of severe fatigue, or signs of lightheadedness, giddiness, or confusion or nausea. Okay. Alright, so that will be it. Are you okay to go?
Yeah, let's go.
Okay. Hello, viewers. Welcome back. So now we'll be doing your balance assessment. So this test is called independent weight test. So the purpose of this test or your balance assessment is to actually identify whether or not you have your balance problem. Okay, so secondly will be to determine your underlying cause of your balance problem if you were to have one. And this is to predict the risk of falls or determine the effectiveness of intervention. And lastly will be to evaluate your rehabilitation monitoring programs. Okay, so for this test, we'll be needing 9-meter pin or line for you to walk on meter. So now I'll be demonstrating on what you should do for the test.
Okay.
So firstly, you go to the edge of the line, your hands by your side, and then you take your first step. Left foot or right foot, I go. Okay. Then next movement, your heel, you go in front of the toes. Move all the way around, follow the line until the end. So the end is there. Go ahead. Okay, so fast forward. After you have reached the end, you will go to a reverse order. So let's say I'm done. Start with my left foot again. Go to heel, till the end.
Okay.
So, not to worry, because when you are doing this assessment, I will be by your side to support you.
Alright.
So, yeah, anything if you want to fall, I think I'll be there. Okay. So, do you have any questions? You ready? Yes, are you good to go?
Yeah.
Feeling well? Yeah. Okay, hi viewers, welcome back.
Hello.
So now what we're doing is a Romwood test. So this is a static balance test, while just what you did was a dynamic test, which is a dynamic test.
Okay.
Okay, so for this assessment, all you need is yourself, no equipment needed.
Okay.
Good. And firstly, I'm going to show you what the procedure will be. Okay.
Alright.
Okay, so firstly, all you need is to stand with your feet together, hands at the side. Okay. Look forward and close your eyes. Alright. And secondly, when you're doing well, you're gonna put your hands away from one another, shoulder width level parallel to the ground.
Okay.
And you slowly tilt your head backwards and bring up your leg at 80 degrees. Okay,
Right.
alternately also. So for 3 seconds.
Okay.
And if I feel like you're doing well for both, then we'll slowly add variations achieve.
Okay, sure.
And okay, before we begin any safety tips, please ensure that the environment is clear. And after, if you want to stop, please inform me and hydrate yourself always.
Alright, sure.
And not to worry, I will always be with you to support you in case if you're falling or you're moving backward or tripping yourself.
Okay, sure.
So do you want to start?
Yeah, let's go.
Good to go. Okay. Right, so firstly is the normal one. You're just going to stand it together, hands at the side, look forward,
Alright.
and close your eyes. 3, 2, 1, back. Okay, now stay at the same position, feet together, but then bring up your arms a little bit. Yes, to the level, to the ground. Slowly lift up your head, tilt backwards. Slowly lift up your right leg. 90 degrees. 3, 2, 1. Okay. Almost there. One more time. Bring up. 3, 2, 1. Okay. Now I'm going to switch to the left leg. Slowly bring up. 3, 2, 1. Okay.
Alright.
Do you want to give it another try?
Yeah, sure. One more time.
3. Bring up one leg. 3, 2, 1.
Okay, never mind.
Okay. Alright, Phil, never mind, not to worry. We will not be moving to the variations because it seems that you have a little bit of balance issue.
Okay.
But later, never mind, I will see the results and I will tell you what you need to improve on.
Alright, sure.
Okay, thank you so much. Alright, hi Phil, welcome back.
Hello.
So earlier we did was the balance assessment, which is dynamic and static, right? Which is tandem gait and normal test.
Okay.
So over here with me is your result. Okay, so for tandem gait, when walking forward on the line, right, seems that you're doing fine, which is good. However, when doing the reversal, when you're moving backwards, you have slight error, around 2 to 3 errors. So it's fine. Okay. But what you can do to improve on that will be training your core, such as doing side leg raise, scissors kick, your planks, Russian twists, etc. There's a lot of training that you can do. As well as balance training like your calf raise, heel raise, etc. And as for your Romberg test, which is a static test, okay, for the first step, like what you did was, at the side, static, when no movement, just look forward and close your eyes. That one is fine, which is good. However, going to the second step where you add variations like your hand forward, knees, legs going up, there's a little bit of like movement there and swinging right to the left, which I have to support you. But it's fine, same as for tendon grip also. To improve on this, you can do some heel raises, calf raises, like what I said earlier also.
Right.
And train on your core also.
Okay, sure.
Because everything is linked.
Okay. Yeah.
Okay. So do you have any issues with that?
No, no issue.
Alright, good. Thank you so much for your
Okay, thank you.